And welcome back. Get Covered NYC is a citywide outreach program that's working to increase access to health insurance and connect New Yorkers to other programs and benefits promoting holistic health. Get Covered NYC, NYC Care, BronxNet, and La Central and YMCA partnered together for an upcoming health fair. And here now to tell us more details, we have the Director of GetCoveredNYC Outreach, Alexander Medina. Alexander, good to have you.
Good morning. Thank you for having me today. Yes, we just want to make sure that the local Bronx community know that this Saturday we have a health fair available, which is free to access for individuals and families at the YMCA from 11 to 2 p.m. At this health fair, families can receive and access free gym classes through the YMCA like yoga or Zumba, the gymnasium for playing basketball, as well as key health access resources uh, provided by local city agencies and organizations. People will be able to have free immunizations for flu, COVID, and monkeypox, as well as donate some blood, receive free screenings like hepatitis B, excuse me, or HIV testing, and other key access to health information and key programs. So we just want to make sure that the local community knows that this is free this Saturday from 11 to 2, and please come and join and share the information to your residents, neighbors, or family.
Alexander, when you talk about this, it's really health information that's available free to the community. A lot of the services that are actually provided are free. From your history, talk to me about community participation. What's it like for you as you roll from community to community, seeing participation?
Yes, well, as Get Covered, and our key is to, reach New Yorkers where they're hard to get, is making sure that we are engaging with our community. Our outreach team this week have been out in the community, in the surrounding area, flyering, canvassing high traffic areas, just to make sure that people are also aware and know about this Saturday. But generally, it's making sure that people are not scared of city resources and just know that the city's here to provide free information and important critical health information. A lot of times, health is about preventative care and not responding to an emergency after. So, health fairs like this are really important to make sure the community knows to come attend, learn about their health, learn how to take care of their body holistically, and just learn more about what they can do for preventative measures.
Yeah. For yourself, you're very familiar with the health insurance process and, open enrollments. Are you finding that more people are more aware of it? Because sometimes that's the thing that gets dropped or lost in the shuffle, not being able to get connected during an open enrollment process.
Absolutely. I think the health landscape is very confusing, and so that's why Get Covered NYC exists, is to help handhold in a way to New Yorkers to making sure that they're aware of what are timelines and deadlines for open enrollment, when should they renew if they have Medicaid or if they need to apply through the marketplace through the state. But generally, there's so many different avenues to access health insurance and free care programs like NYC Care that we just want to make sure that every New Yorker who's uninsured has the information they need to access different insurance pathways or care programs if they are uninsured and unable to enroll in health insurance.
A popular thing that comes up is sometimes people have questions about immigration status and where they fit in with regards to health care with an immigration status. So walk us through a little bit about if you have, no matter the immigration status, I assume that there is still care available.
Yes, absolutely. There are so many different individual cases. So part of the pathway when somebody comes and gets connected to Get Covered is we schedule an enrollment appointment with a navigator and enroller so that that person can walk through the application and enrollment process with the individual or family. And depending on the person's situation and documentation that they have, they will see what they are eligible for when it comes to different insurance programs. If somebody is not eligible for an insurance program, then people are still able to enroll in Health and Hospitals NYC Care program, which is not insurance, but it's a care access program where an individual or family can still receive a membership card, see a PCP, receive immunizations, preventative care. But it's not specifically insurance. It's a way that New York City is providing access to care for those that do not qualify.
Are you seeing any common threads as far as what people need during this time as you're walking out and about the community?
I think it just varies. Again, depending on the community, there's different health needs. When it comes to access to care, a lot of times people just go to the doctor or usually see the ER instead of doing regular immunization or preventative checkups. So it's really just about educating the public and the community to take care of their health throughout the year, and not just when it's an emergency.
So for yourself, it's got to be a good feeling being out and about, getting people educated, and really, after this COVID situation, having an opportunity to really be a part of the healing process and getting people in the area of health in a better shape.
Absolutely. Our outreach team are dedicated, passionate public health educators that, on a day-to-day basis, when they're speaking over the phone or in the community with uninsured New Yorkers or people that might have health insurance, they're just confused on how to access care or what to do next. Our team is there to educate and really provide that next step in case management to make sure that every individual in New York City that is connected to Get Covered is truly getting covered and connected to what they need to do to holistically provide a healthy life and lifestyle.
Yeah. How long is the application/enrollment process? Is that a real tough thing to do?
It varies depending on a person's situation, but generally, if somebody is trying to enroll, depending on the program, before the 15th of the month, they can start the coverage on the 1st of the following month. But it really just depends on the type of health insurance program a person is eligible for.
Okay.
The application process itself is not that long. It's just a matter of when your coverage starts. So
Yeah.
the main thing is to make sure that somebody is connected and insured.
And that's why you're here, right? To make sure that people can be
Yeah.
able to do people can be able to do that. So for people who do need that information, please go ahead and tell them how they can do that.
Yes. So if, again, this Saturday, you're available, you can come to the YMCA La Central to access this information and these services at 434 Westchester Avenue. You can also go to our website at nyc.gov/getcoverednyc. You can also call 311 and just say get covered, or you could text covered NYC to 877-877, and a Get Covered specialist will reach out to you the next business day to make sure that we are answering your questions and schedule a health insurance appointment for you.
Well, Alexander, I know it's a pressing need for so many people to be able to have health insurance. Glad to have you out there to be able to assist in that area and really just getting people to the right place. So thanks so much for being with us.
Thank you for having us.
All righty. Well, again, for our viewers, if you want more information, you can visit the website at on.nyc.gov/healthcare fair. Don't go anywhere. We got more open coming up right after this.